Hi, everybody. My name is David Opp. Close from Mike. Yep. My name is David Opp. I work at Boston Medical Center in my 9 to 5 as a senior manager of federal advocacy. I imagine my talk will be a little different than a lot of the other talks you were a part of earlier this weekend. And I appreciate you all for having me here and sticking by. I think Dr. Pody invited me to speak with you all to sort of end on an optimistic note, right? To talk about the federal government. So for those of you who haven't been, trying to refresh your New York Times to understand, like, let's just go with the question that's on everybody's mind here. So, is the federal government staying open? So maybe you're getting the alerts. So the the House did actually pass something earlier today. So there's a much more hopeful sort of note being struck down in DC. We'll see what that means for Speaker McCarthy, because it required all Democrats to vote for it, and 90 Republicans voted to oppose it. I guess we're at an addiction conference, so I can say this. Representative Matt Gaetz from Florida said he sees it as shot chaser in terms of voting for this bill and then voting basically to remove Speaker McCarthy from his speaker role. So 1-2, that's how Matt Gaetz sees it. So interesting. Anyways, the sort of details of that I can sort of just brush through. I want to give you my sort of goal for today is to give you sort of a primer on what's happening in DC, get you all up to speed on the latest, like, what's happening with government funding, but then transition to talking about, I think, what we all are most interested in hearing about is the addiction legislation under consideration in DC at the moment. And so, but if the government's not funded and Congress isn't able to wrap up this work, then nothing else gets done. And so I think it's a good sign that, they have 7 hours, the Senate. And I just was getting texted that the Senate looks, I'm not in the prediction business, but it looks likely they're going to pass what the House passed. Interestingly, no funding for Ukraine for folks who follow that issue, but there is funding for disaster relief, thinking about all the major natural disasters in the news. But other than that, it's pretty much flat funding for 45 days. And so I'll get to this, but we're likely going to be in the same position that we're in right now 45 days from now. So never a dull moment. Anyways, so how did we kind of get here? What is the environment in DC? I think, we all kind of, just from the news, kind of have a sense of generally, what things are like down there. But, how things are different from the past couple of years is that, beginning this January, we actually entered back into it's an era of divided government. And so Republicans have a slim majority in the House. And I think over the last few weeks, you saw basically that playing out, that very few members of Congress can oppose something and actually stand in the way of legislation, or in this case, funding the federal government, stand in the way of that happening. Speaker McCarthy, so I had mentioned his job is on the line here, took him 15 rounds of votes to even become speaker. And so lots of questions as to how much longer he'll be Speaker of the House. Although there's nobody who's really like volunteered to run against him. So I think, he takes that as a hopeful sign, I'm sure. Democrats have an even slimmer majority. You might remember that the elections in the fall, this past fall, Democrats in the Senate actually picked up a seat. So it was 50-50 last Congress. Now it's 51-49. Also, the news that Senator Feinstein recently passed away brings that sort of temporarily to an even slimmer margin of 50-49. Obviously, Governor Gavin Newsom is going to have a say as to like who's going to take that Senate seat. And that's a very interesting Senate race in general. But so that's kind of just the high level, like things. This is how we arrive at gridlock, is there's the power struggle between Republicans and Democrats, of course, but there's also such slim majorities in either side that things require consensus more than they otherwise might if one party had majority in Congress. And obviously, President Biden being a Democrat in the White House. So also hard to not be aware of the sort of backdrop, or I guess what's sort of looming over all of this other than the government shutdown is, the potential rematch of, President Biden, former President Trump in 2024. And so a lot of like the political moves you see happening are kind of the preludes to the campaign. Obviously, Republicans, there was a debate earlier this week. I didn't tune in, but everybody to each their own. So there's a Republican primary going on. Donald Trump has to win that primary in order to become the nominee, but he has such a large margin in the polls that he's sort of the presumptive nominee until proven otherwise. And so kind of thinking about the environment down there, the Republicans in the House actually opened up an impeachment inquiry. And so when you start trying to think of like bipartisan issues, it becomes harder when, the opposing side is opening up an impeachment inquiry. And, so I think in the news, we get a very doom and gloom report about what's happening in DC. And I kind of want to take a moment to step away from that, because I actually think, addiction legislation is actually has longstanding bipartisan, bicameral support. And bicameral is just a fancy way of saying House and Senate. And so, there's actually real opportunity here now that, knock on wood, the government looks like it's going to be funded, to be able to weigh in with Congress, for, as I'm speaking to you all as experts in this area, to weigh in on the sort of things that you would like to see included in a comprehensive addiction legislation. And so maybe like a little bit of history here. The reason that, or not the reason, but the sort of evidence that it is such a bipartisan issue requires you going back into previous Congresses. So the Support for Patients and Communities Act actually is the last sort of major comprehensive bill that was passed by Congress, and that was 5 years ago, almost to the date. And so the way Congress does things, oftentimes they provide sort of an authorization for a set amount of time. In this case, a lot of the funding that was authorized in the support, you can call it the Support Act for short, was given sort of 5-year authorization. So that is coming up for expiration actually midnight tonight. And so because of what's been happening in DC, sort of that picture I painted, it's not going to, the reauthorization of this bill is not going to pass by midnight tonight. But it's not unusual for things to fall out of authorization. So just when this bill, the Support Act reauthorization bill, is taken up, it will just, the clock will start over. And so the sort of bipartisan side of this that I just wanted to point out is that, this bill is working its way through the committees. And so the committees that matter for us is the House Energy and Commerce Committee and the Senate Health, Education, Labor, and Pensions Committee. And so both of those committees are reviewing a bill to reauthorize the Support Act. The House actually advanced it unanimously, not a single vote against it. And so there's very few things nowadays that in this Congress can pass with any sort of unanimous support. So I just want to say, the work that you all are doing, it gets noticed in part because of, how bad things have gotten in terms of every single district is impacted by, addiction. Particularly, in Congress, I think they most front of mind for folks is the opioid crisis and the fentanyl crisis. And so I think for you all, when you have something that you want to say, legislators are going to listen. And so in terms of other sort of examples, although the last major piece of comprehensive legislation was 2018, there have been other provisions that have passed, and you all will have already felt the effects of these. The Mainstreaming Addiction Treatment Act, or the MAT Act, got rid of the X waiver, so we're already seeing the impacts of that. And that passed at the end of last year. So again, it wasn't unanimous. That was, there was some opposition there, but it was very, very much a bipartisan vote. And prior to that, you'd have to go back several Congresses to 2016 for the 21st Century Cures Act and CARA. And so I think there's an appetite in Congress to do something, and I think this is seen as must-pass legislation, which in DC is, there's a deadline which they're going to miss, but they don't want to Congress doesn't want to let all of these funding for these programs expire. And so that presents an opportunity for, well, instead of just reauthorizing, what else should we be doing? Obviously, in 5 years, as I'm sure this conference, was covering, I unfortunately wasn't here for a lot of the sessions, but just how much things have changed in 5 years. Obviously, the overdose death numbers have continued to tick up. I think I saw somewhere in 2018, national numbers were around 70,000 overdose deaths, and now we're over 100,000. And so there really is bipartisan interest to do something. And so there are bills out there that have, on the House side, they've actually gone through the process. So they've been, amended and marked up. And so it hasn't gone to the House for a vote yet. So there's an opportunity still to advocate with the House about, what that, one, passing this bill is important, and two, if there are any things that aren't included in it, there's still an opportunity to potentially, see changes. On the Senate, it's much earlier in the process, and so there's an opportunity in the Senate as well. And so these are some of, this is not a comprehensive list. It's a big bill with lots of provisions, but these were some of the sort of headlines coming from it. I realize I might be standing in the way for some folks. So a lot of these are things that were included in the Support Act originally, but the top one, in terms of requiring Medicaid programs to cover all forms of medication for opioid use disorder, that was a temporary extension, which fortunately is not set to expire at midnight tonight. It's set to expire sometime in 2025. But this bill looks to make that permanent, so then it doesn't have to go before Congress every few years to be re-upped. I know just from my work at Boston Medical Center, that BMC has taken up the repayment program, the STAR loan repayment program, so re-upping funding for that. And actually, Congresswoman Catherine Clark was really pivotal in getting that program across the finish line. So we have really, I'll get to this a little later too. We're really fortunate to have great representation in Massachusetts. And then it also includes full Medicaid coverage for pregnant beneficiaries who are incarcerated pending disposition of charges or pre-trial. And so I'll also get to this when I talk about what's not in the bill, because interestingly, I don't know the backstory why they carved out pregnant beneficiaries in particular, but there is legislation to make this for all beneficiaries, Medicaid beneficiaries who are awaiting trial. And then the IMD exclusion was partially lifted in the Support Act of 2018, and so that opens the door for federal funding to go towards providing that kind of care in those settings. So that's, and in terms of questions, I'm really interested to hear. I was going to ask about how the government shutdown may or may not worry you, impact your work, and maybe that's a question for another day. But if there are grants that you're working on, or you're hearing from patients about programs that they rely on that maybe would have been at risk. I'm still interested in hearing that stuff. Obviously, we could be back at it again in 45 days, as I said. And there are a number of programs that fall under sort of discretionary programs that would be their funding would be held up if there were a government shutdown. Fortunately, again, in Massachusetts, I've heard from a number of the state agencies that oversee things like WIC and TANF and SNAP that they've been out front to say like your benefits will not be impacted, particularly in the event of a short shutdown. I think everybody was cautious to not try and make predictions of what would happen in a long shutdown, but you can sort of assure your patients there that there shouldn't be interruptions to those government programs. These are bills. So the sub-bullets are all bills that have either been previously introduced in the case of the Opioid and SED Workforce Act. I don't think it's been reintroduced yet. And then other bills that have been introduced this Congress. And so these are all opportunities in terms of what Congress could potentially fold into the Support Act reauthorization that they have so far chosen not to. And so methadone reform, which I know folks in this room are well aware of this sort of idea, but Senator Markey actually is the lead sponsor on the Modernizing Opioid Treatment Access Act. And so in short, that would allow addiction medicine physicians to prescribe methadone and pharmacies, retail pharmacies to be able to dispense. And so really opening up methadone access outside of OTPs. I mean, it's great. I mean, honestly, Senator Markey has been out front with this. It was something he introduced last session. And I think there is still an uphill battle in terms of educating members of Congress as to why this is important and why it's needed. And so, that's something that when I say, addiction legislation is overwhelmingly bipartisan, I feel like on this particular issue, it seems like Republicans are a little more skittish about making changes in this area. So something to be aware of in terms of opportunities for additional advocacy. And then, Medicaid, folks who are, the Medicaid Reentry Act is for folks who are currently incarcerated 30 days prior to release, being able to be put back on Medicaid, which I understand is really important for, you can start medications, particularly medications for opioid use disorder prior to release. And as you all know, the statistics are really dire for risk of overdose prior to release from incarceration. The Due Process Continuity of Care Act is the what I was talking about earlier with for folks who are pre-trial. The bill carved out specifically opening up, for folks who are pre-trial, who are pregnant. Medicaid would be an option if this bill were to pass, but there's a bill before Congress that would just, if you're awaiting trial, you could continue receiving Medicaid. Interestingly, too, the bill, this is actually something that the bill does include. Instead of terminating Medicaid upon arrest, it would suspend Medicaid. And so that, I think, actually makes things easier for release in terms of getting back onto Medicaid. So there's plenty of good things in there that are new. And then scheduling is an interesting thing. I find that Republicans also seem to be more in favor of the scheduling side of things. There is a temporary scheduling of fentanyl and fentanyl analogs in terms of particularly fentanyl analogs, I believe, are Schedule 1, but that is a temporary measure. And so there's legislation that's not included in the Support Act reauthorization to make scheduling permanent. There's also a provision in the bill to have federal agencies kind of assess the scheduling of Suboxone and basically like analyze, does it make sense to change the scheduling of it? So for folks who are interested in knowing more about like particular provisions that I'm not mentioning, I'm happy to, email after or chat after. But this is kind of the, the headlines of what's in and what's not in. And I'm happy to take questions on this at the end. So in terms of what's next, like I said, there's at this point, it's obvious there's going to be a lapse in authorization, but that's not, shouldn't necessarily have an impact. And so what we'd be looking for is, the House to actually vote on the bill, the full House. And I think more, because it's earlier in the process, the opportunity to engage in advocacy in the Senate is richer because it's earlier in the process. And obviously having somebody like Senator Markey on the Senate Help Committee, also very interested in particular aspects of addiction legislation, being the lead sponsor of the methadone bill. There really is an opportunity to, in the Senate to try and improve the bill and sort of encourage them to take up the bill sooner rather than later. So kind of in the next few months, I'm, again, not really in the prediction business, but what I'm understanding is that, this will likely be taken up in the next few months. And depending on how like the schedule for government funding works out, this could all sort of be aligned for like a really big end of year package, which is seeming to be kind of more and more routine, that they have these sort of consolidated bills at the end of the calendar year. On the House side, Congresswoman Trahan she's the Massachusetts, represents the 3rd Congressional District, kind of northern central Mass. So she's actually on Energy and Commerce. So staff for either of these offices are very well versed in this issue and really would be interested in hearing from folks on the ground. In terms of the government shutdown, I had mentioned this at the beginning, and I made these slides. Frankly, I was doing them late last night because I was trying to be as current as possible when it came to this, and obviously things change. But like I said, it sounds more positive for this most recent sort of gridlock that the Senate, and they might even be voting on it now, frankly, are looking to pass what the House passed, and so averting a government shutdown. But we could be very well in the same place 45 days from now. Yeah, light at the end of the tunnel. Could be sort of a hopeful note. It could also mean, is it the government shutdown train coming down the tunnel again? And so just things to keep an eye on as you're thinking about sort of what's happening in DC. There is sort of a rhythm to how things happen in DC, and obviously, as we saw with this latest debacle, things get really to a fever pitch. And that's almost like by design in terms of each side trying to, get their best negotiating position. So, I would expect we'll be back in the same place. And yeah, that's what I had prepared. So happy to take questions and yeah, hear from you all kind of what you're interested in seeing, things that I didn't mention, or things that maybe directly impact your work related to government shutdown, really anything that I talked about. Thank you. Hi there.
I went to a meeting on methadone in New York City, and Representative Norcross, who is the co-sponsor of the methadone mini step expansion, was asked why it wasn't bigger. And he said it's the cartel that prevented it from being larger.
Yeah.
And I think I know what the cartel is.
So, yeah, Congressman Norcross, I think, was referring to, OTPs as the cartel, that quote.
Hi, my name is Mohammad Ali Chaudhry, and I'm a fellow from Boston Children's Hospital. Could you clarify about the scheduling thing that you mentioned about buprenorphine? What do they want to do with the schedule?
Yeah, so it's they're not proposing to change anything in the bill, but they're proposing to have the federal agencies that oversee scheduling, HHS, and the FDA to assess whether there's any sort of pros and cons to changing scheduling. So if the law were to pass, nothing would change, but the federal government would have sort of a directive to look into it. I'm guessing it would be lower, but yeah, I think that's right.
Michael Beaver, Boston Quickie. The Methadone Modernization Act covers prescribing by APPs who are specialists, or only MDs, DOs who are specialists?
Can you just explain the acronyms for me?
I'm sorry. Nurse practitioners, PAs, who may have a special training in addiction, could also, under that act, prescribe methadone dispensed in pharmacies, or no?
The bill as written is it's exclusively physicians as it's written. And I think, as we saw with kind of previous iterations of addiction legislation, there's a starting point, and then, with the Support Act and some of those, even CARA and 21st Century Cures Act, they started to widen the aperture of who could prescribe buprenorphine. And so you could imagine that this is what the legislators think they can potentially get. And then, once it becomes normalized, you start opening the door to, more providers, a wider array of providers being able to prescribe. That's my sense.
I'm Emily Regier, Addiction Medicine Fellow at Boston Medical Center.
Awesome.
Thanks for the updates. I have two questions. One is for the methadone reform legislation. I know you said it's kind of an uphill climb at this point. I guess how close do you feel like we are to that being passed, and who do we need to bug to make it help us get closer? And then second question is there any talk at all about federal action to allow safe consumption sites or overdose prevention centers?
Yeah, no, good questions. On the methadone bill, I think, the fact that it's not currently included in the reauthorization bill is a sign that there wasn't enough consensus. And so I think the prospects of it passing as a standalone bill are highly unlikely. And so kind of the opportunity now is the train leaving the station is this must-pass legislation, which is the Support Act reauthorization bill. And so it's kind of prime time for trying to encourage Congress to take it up, to take up the methadone bill as a part of that. And so I think, some of if it doesn't get included into that, I do think that there's enough interest that there could be sort of, a reset, what is left that isn't covered in this bill, and then, the methadone reform bill kind of, I think, rises to the top. That doesn't mean it's necessarily being teed up for passing, but that there's, I think, a real opportunity to present it as something that should be next on the list. But I think the opportunity is now to try and push for it in the current reauthorization bill. On safe consumption sites, again, thankfully, Senator Markey has a bill that it doesn't legalize it, but I think provides the opportunity for the federal government to look into it. And so obviously the states are, and the localities, municipalities are much more further along on that path, but it has been seen as kind of a third rail, even for, I remember when I started at BMC, we were talking with potential congressional suitors, like who would bring up a bill among our delegation. And even then it seemed like it was, they weren't even interested in introducing it. So the fact that this is in the Stop Fentanyl Overdoses Act, there's a provision in there about, the federal government researching that. Yep. Okay.
There's a stimulant epidemic underway. The only effective evidence-based approach, which is quite effective, is called contingency management, where we
Yep.
actually reward patients for attendance and treatment and working towards abstinence. The White House ONDCP National Drug Control Strategy says this needs to be advanced nationwide.
Mhm.
OIG has approved the full evidence-based approach. SAMHSA will not fund an evidence-based level of rewards because they've been told by the Domestic Policy Council this could trigger Republican backlash.
Mhm.
So we're not going to get the White House following through on the executive branch's efforts to fund this at an evidence-based level. There are 100 papers of controlled trials in the published literature showing this. There are a dozen meta-analyses. Is it time to recruit some legislators who are willing to stand up for an evidence-based approach? Because otherwise we have total network inadequacy nationwide for this whole class of patients.
Yeah, no, it's a great question. And I think, California obviously received approval for its contingency management and Medicaid. And so, the states are kind of not waiting, necessarily, at least, the states that are interested, very few, right. But I do think it's right for legislative action. I think this idea of, safe harbor from anti-kickback statute is
That's
the
been settled.
right. So it does seem like, and I'll have to look back at like where legislation sits on that. If there is something that's already been proposed, I'm not aware of it, but I agree with you. That is something that I think, was an omission from the sort of not in that I think is in that sort of top of the list as to like what's ready made. Yeah.
Thanks, Dave.
Yeah.